Okay, so let's continue our next session of this discussion on FMGE past year questions. Now let's start with question number 6. Okay, I hope this type of discussion will really help you. Infant is admitted with respiratory distress and prolonged expiration with rhonchi in chest or heart. So when this type of questions are asked, by the description itself you can understand. Okay, this is a case of respiratory disease. Okay, with prolonged expiration means the lower airway, the smaller airways are narrowed, and rhonchi or wheeze means it is proving that it is a problem of lower airway narrowing. Chest X-ray shows hyperinflation, means there is air trapping. What is the diagnosis among the following? So this is infant. This is important point here. It is clearly having lower airway obstruction and hyperinflated lung. And this is a clear-cut case of bronchiolitis. Bronchiolitis. Okay, bronchiolitis presents like this. Sometimes it may present with a slight fever as well, a bit of upper respiratory tract infection in the beginning, and after 3 to 4 days, these classical signs and symptoms will appear. Now, what is the cause of bronchiolitis? This is caused by respiratory syncytial virus. It is the most common cause, though there are some other viruses which can also cause it. But whenever the question comes, remember RSV is the answer here. Okay. Bronchial asthma is not very common in the infantile age. Okay. The asthma means recurrent airway obstruction or narrowing because of the inflammation. Croup. Croup is also known as acute laryngobronchitis. Okay, so it is mainly caused by parainfluenza virus, and other respiratory viruses, of course. I'm just talking about which is the most common one. Okay, and pneumonia. Pneumonia is the inflammation of the lung parenchyma. It is caused by viruses, bacteria, and some other atypical organism as well. And in pneumonia, the presentation is not like that. Okay. Mainly when we auscultate, there will be crackles in the lung, and the baby will be having high grade fever if it is a bacterial type of pneumonia. So this is a pretty simple type of case. Let's move on. Question number 7. Which of these is used in the treatment of bronchiolitis? Here just now we talked a little bit about bronchiolitis. Now another question is asked here. Which of the following is used in the treatment of bronchiolitis? I just now told you the most common cause of bronchiolitis, okay, in infant is respiratory syncytial virus, RSV, and ribavirin is the drug which is used for the treatment of that. Ribavirin. Ribavirin is not, okay, ribavirin is not, commonly used. I mean, for all the babies, we don't use ribavirin. If the baby is immunocompromised or having serious symptoms and sign, then we can consider using it. Okay, amantadine is not used in this case. Amantadine is used for the influenza virus. Racemic epinephrine, it is commonly used in the treatment of croup, where there is edema of the airway. Okay, and corticosteroids are mainly used when there is a severe inflammation of the airway, and one of the indication is bronchial asthma. Number 8. Okay, 6th day disease is which of the following? This is straightforward question, and sometimes our questions are very easy in FMGE exam or any of the licensing exam. Remember, some of the 10 to 15% of the questions are pretty easy, and sometimes student will think, how can they ask such an easy question? They may think like that, but don't worry, this is the way examination is taken. A majority of the questions are moderately hard, and around 10 to 15% questions are again very difficult. Okay, this is the way examination is taken. So this is pretty simple one. 6th disease is Exanthems subitum. Exanthems subitum. Okay, this one. Exanthems subitum is caused by human herpes virus 6. Okay, human herpes virus 6 Okay, so this is Exanthum subitum. It is also known as, okay, by other name. Okay, and Exanthum subitum is not a very serious virus disease. Okay, it is known by Roseola infantum. Okay, that is another name which I was just talking about, and it's not a very serious disease. Many of the babies, they recover by themselves. Okay, Exanthum subitum. And in Exanthum subitum, I want to provide one more point here. A fever comes, and when the fever subsides, then the rashes comes. Okay, so this is a little bit typical regarding Exanthum subitum. Now some other discussions here. Erythema infectiosum is known as fifth disease. Okay, and in this there is a slapped cheek appearance in the child. Slapped cheek appearance means both of the cheeks are very red, they look like slapped, and it is caused by, okay, parvovirus B19, which is a type of DNA virus. And remember, one important question is always asked from here. This parvovirus B19 can lead to aplastic crisis in case of hemolytic anemia case. Okay, and this aplastic crisis is a misnomer because it mainly affect or only affect the RBC series. So there will be serious anemia in this condition. Erythema marginatum is seen in rheumatic fever. It is one of the major criteria for rheumatic fever. And erythema nodosum, okay, these are painful and red lesions in the lower limbs. Importantly, in the shin of the lower limbs. They are painful and they are mainly present in tuberculosis and sarcoidosis. They are also present in some of the bacterial as well as viral infection. So they are erythema nodosum. So many of the students are commonly confused here. So there is no point of confusion here. Okay, let's move on. Question number 9. Protein in cow's milk in comparison to human milk is how much? So this is an important question here, dear students. So see here, protein in human milk, okay, in human milk, the protein amount, okay, is 1.1 gram per deciliter, whereas in cow's milk it is almost 3.1 gram per deciliter. Now your answer is very simple here. It is triple. Okay, it is 3 times more protein in cow's milk in comparison to the human milk. Now what is the implication of this? Why they have asked this type of question to you? Now remember, when the baby is born prematurely, if the parents feed cow's milk, not only prematurely, any other type of babies as well, if they feed cow's milk from the very beginning or from the very early life, then because of the too much protein load, okay, that can damage the GI epithelium, and from there a lot of problems can arise. And one of the problem which can happen, okay, is called necrotizing enterocolitis. So this is also an important one. Okay, for this session, this is the last question I am going to talk. Gynecomastia in neonate is seen due to what? Now see this, pretty simple but a little bit of tricky one. Okay, when the mother takes estrogen hormone, this estrogen hormone can cross the placenta and goes to the fetus. And when this fetus is delivered, okay, when the fetus is delivered, the estrogen hormone is still there in the body. Estrogen is still there, okay, in the fetus body. Now we don't call fetus, we call newborn, and because of that estrogen there is an enlargement of the breast and we call it gynecomastia. Okay, so what is the treatment of this? Many of you are wondering what is the treatment of this. The treatment is just wait and watch. You don't need to do anything because that estrogen hormone is not going to stay there forever. It is going to disappear very soon. and the breast size will come back to the normal. So A is the answer here. Okay, so let me end this session and we'll continue this type of session again. Thank you.